Hi, I'm Alexa, a sports physical therapist at Nicklaus Children's Hospital. In this video, we will show you what to do between 7 and 9 months after your ACL surgery. At this point, the focus of rehabilitation is to prepare you to return to sports. It is important to perform these exercises 3 to 4 times per week. You will perform all exercises on each side. This exercise is a side plank. For this exercise, you want to be laying in a row on your side as so, and you're going to come up onto your elbows. You're going to come up onto your elbows so your hip is off of the floor and you're maintaining an upright trunk, a neutral pelvis with your feet on the floor. The goal is to hold for about 45 seconds. If this position is too difficult, you can come back down to the floor, bend your knees, and come up again using your knees as the point of contact on the floor. It's important to remember to keep your abs tight and your glutes engaged to help promote good core control during the side plank. This next exercise is called a single leg squat. For this exercise, we're going to be standing on one leg with our hands on our hips. We're going to keep our chest pointed nice and tall as our hips move backwards as if we're sitting in a chair. As our hips sit back, we're then going to push our foot down through the floor to stand ourselves back up nice and tall. It's really important to keep your chest up and centered so as you're not leaning side to side, and also it's important to keep your kneecap pointing forwards to avoid that position of dynamic valgus collapse. This exercise is the single leg squat. This next exercise is a double leg jump forwards. For this exercise, our hands are going to be on our hips, and then we're going to load down into a squat position. After we load, we're going to explode forwards, again landing in a squat position. It's really important that as we do this double leg jump, our chest stays up and we land nice and soft on the ground. You can tell if you're not landing softly is if you make a very large noise when you land and your knees stay stiff. So the goal of this exercise is when you jump forwards, you're going to land nice and soft in a squat position. This is the double leg jump. This next exercise is also a double leg jump, but for this one, we're going to be jumping to the side. So we want to start with our hands on our hips and we're going to load into a squat position. As we come out of our squat position, we're going to explode up and move to the side. We want to make sure that our chest stays nice and tall and that our knees keep pointing forwards. We want to avoid landing hard and landing stiff. So please make sure that when you practice this and when you land, the landing is nice and soft and not loud. This is our double leg jump to the side. This next exercise is a single leg hop. For this exercise, we're going to be standing on one leg with our hands on our hips. We are going to load into a single leg squat position, and as we jump out of it, we're going to jump up in the air, and our goal is to land back in that single leg squat. We would like to hold that position for a couple seconds to maintain our balance. As we're jumping here, you can see Carlos is maintaining his shoulders in a neutral position. He's not leaning over side to side, and his kneecap stays pointing forwards. From the side view here, you can see that as Carlos loads back, his hip is moving backwards, his chest is staying tall, and as he jumps up and lands back down, the line from his shoulder to his hip is parallel to the line that his shin makes. This position is a position of power and what we look for during our single leg hopping. I hope you found this video helpful. Please reach out to your physician or physical therapist with any questions that you have.